I just explain it like this: it's because of the condition of the body. In severe cases, it can even cause chronic pelvic pain and indigestion, so you have to deal with it in advance so that there won't be a big problem later. I just say it like that. It's because of the quality. Why do we catch a cold? If you keep living, you can catch a cold, and you can get sick and get healthy again. The same goes for the vaginal area. When our overall health declines a little, it can also affect that part. The internal vaginal environment itself becomes disrupted, breaking its natural ecosystem, which leads to inflammation. That inflammation then manifests as symptoms. That's what I explain. Of course, the type of vaginitis is a slightly different matter. If it's not a sexually transmitted disease but rather vaginitis caused by the bacteria that normally reside in the vaginal area, that's how I explain it. If it recurs too frequently, it's important to check if there are any underlying conditions. Conditions that weaken the body, such as immunity-related issues or diseases like diabetes, are common examples that should be investigated. In cases where vaginitis keeps recurring, this is quite common. For patients with recurrent vaginitis, we often recommend getting tested for diabetes. So, there are cases where we diagnose it and refer the patient to internal medicine. If the patient has a heavier body type or a family history of diabetes, we recommend getting such tests done as well. Additionally, when we prescribe medication for vaginitis, we suggest considering these factors together. Some patients stop taking the medication as soon as they start feeling a bit better. However, we doctors usually prescribe the medication for at least 3 days. You need to take the medication for the full 3 days, but some patients stop after 1 or 2 days when they start to feel better. If this pattern is repeated continuously, it can lead to issues. This is what we call developing resistance to the medication. In such cases, a biofilm can form inside the vaginal area like a protective film created by bacteria. These bacterial biofilms can reduce the effectiveness of the medication by lowering its permeability when it is used again in the future. And then, later on, it becomes like this: "Oh, doctor, the medication you prescribed doesn't work anymore." Some patients express dissatisfaction, saying, "Shouldn't this be treated in a different way?" At that point, it's worth reflecting on your past habits regarding how you took medication. Considering this can be helpful because such habits could contribute to the frequent recurrence of the condition. Women have a very unique reproductive anatomy. For instance, the vaginal environment typically has a strong acidity, with a pH of around 3.0. However, when inflammation occurs, this pH level can shift toward neutral or even slightly alkaline. As the inflammation worsens, the problem is that the infection can spread from the vagina to the uterus, leading to further complications. Then, it can spread into the pelvis, as everything is interconnected. The reason why the vagina maintains such strong acidity is significant. As I mentioned, the pelvic area is connected, and inside the pelvis, it is a sterile environment. In other words, no other bacteria should reach the pelvic area. That's why the vagina, as the entry point, acts like a protective army, guarding against intrusions. Lactobacilli play a key role here. They produce strong acidity by utilizing lactic acid, creating an environment where harmful bacteria cannot thrive. That's how it's supposed to work. However, if vaginitis keeps recurring and is left untreated, harmful bacteria can eventually travel up into the pelvic area. When this happens, it leads to an inflammation known as pelvic inflammatory disease. Pelvic inflammatory disease (PID) caused by ascending infections is quite serious. It can start as acute PID and progress to chronic PID, with the inflammation potentially spreading to areas as far as the liver. In severe cases, it can lead to chronic pelvic pain and even infertility. To prevent such complications, it is crucial to address vaginitis promptly whenever it occurs, rather than ignoring it or delaying treatment. You should think, "My body is just feeling a bit off, and I need proper treatment." Then, calmly visit a gynecologist and receive the necessary care. When we dress up and wear nice clothes, we might choose tighter underwear. However, when you're at home, it's better to wear comfortable underwear like boxers or even go without underwear if that feels more comfortable. When sleeping, try to keep things cool and allow for some ventilation. Avoid wearing tight-fitting clothes during that time. That's perfectly fine. When you're at home or sleeping, try to live comfortably. Avoid wearing leggings or tight-fitting clothes too often. This is something to keep in mind. Relying too heavily on flour-based foods instead of rice is not ideal, as it can raise blood sugar levels and potentially lead to conditions like diabetes. Such issues can weaken the immune system, which in turn can lead to candida infections or various bacterial vaginitis cases. Alcohol, smoking, and similar habits can also impact an individual's immune system. Regarding vaginal probiotics, many people take them frequently. But in my opinion, vaginal probiotics should be not relied upon as a treatment. Vaginal probiotics are not a cure, so rather than blindly trusting them or depending solely on them, think of them more as a supplement, similar to vitamins, that can provide some support. Taking them can be very beneficial, but relying solely on them isn't the best approach. There are many people who rely on probiotics and avoid visiting the hospital. While taking vaginal probiotics is fine, the best approach is to visit a gynecologist promptly if any issues arise. I, too, used to visit the gynecologist in my 20s whenever I had inflammation. Older women around me would look at me like, "Why is a young girl here?" If you weren't pregnant, they'd often give strange looks, as if it was unusual to be there. I remember feeling very intimidated myself when I visited the gynecologist. When you undergo an examination, sometimes there are doctors who perform it a bit too roughly. After experiencing that kind of treatment, many patients hesitate to return. It's not uncommon for people to have unpleasant memories associated with visiting the gynecologist. These experiences can leave a lasting trauma, leading people to say, "I don't have major symptoms, so I'll just stop going altogether." There are also people who have never had any sexual experience, who think, "I probably don't need to go to the gynecologist at all." Many people think going to the gynecologist feels uncomfortable, awkward, and inconvenient, so I'll just skip it. However, nowadays, there are many female doctors are making a significant effort to lower the barriers and make visits to the gynecologist more comfortable. Of course, I feel the same way. When you visit the gynecologist, it absolutely doesn't hurt. If something feels uncomfortable or painful, I draw from my own patient experiences when treating others. So, you don't need to worry too much about those things. Just think of it as going to protect your health as a woman and approach it comfortably. Think of it as addressing a health issue early on. Preventive action now avoids future problems. In the case of gynecology, unlike other medical fields, if a major issue arises later on, it can often be much more complicated to treat. Situations like infertility or early menopause could occur, making gynecology quite different from other specialties. By addressing issues early, you can prevent the worst-case scenarios. It's important for younger individuals to take proactive steps and visit regularly. Regular care and checkups ensure smooth treatment without major issues. You'll come to see it as a specialty where you can receive care. Please feel free to visit without hesitation.